Pfizer is the longest continuous donor to the floating hospital. A check for $10 was sent by the founder of Pfizer in the 1860s. Since that time, Pfizer has remained an active and generous donor in more ways than we can count. Money, staff, technical assistance, goods and services. And part of what the floating hospital is today is due to that relationship.
Pfizer is a company that brings people and science and dedicated effort together as a way to provide the best solutions, whatever those solutions may be. As important as it is to be a productive employee and to bring value to the company and then to be as effective in your job as you possibly can be, that really only describes a very small part of what being at Pfizer is all about. It really is about being engaged with the community, being engaged in all the different parts, again, of health and of life as we know it.
Well, what can I say about Randall Kay? He's become part of our team. I know he's part of the Pfizer team, but he also is part of our team. Pfizer has given him the freedom to practice medicine in our midst for a half a day each week, which really works out to just about 10% of our patient load. He has created and organized the whole asthma and allergy program. He's trained our health educators and our social workers, as well as our other physicians. He has changed the lives of dozens and dozens of children. And that may not be very impressive on a spreadsheet, but in terms of health outcomes, we think that's a spectacular result.
The floating hospital has been particularly worthwhile because of the patient population that it serves. It's internally been extremely gratifying for me just to participate in this. What am I seeing to engineer here for today?
Okay, it's a breathing. The nurse told me to come down here. We have a visiting nurse where we're at.
Okay. We initiated a allergy and asthma clinic. And I think that's probably been one of the most gratifying aspects because we're now able to take care of a population that basically has had no access to a specialist, no access to continuous care. A lot of these patients, in fact, manage themselves acutely through going to the emergency room or have pretty inconsistent follow-up. What we've been able to provide here at the floating hospital is that consistency. Okay, but we're going to need to be real careful that she's taking the right medicines. I'm more likely to work with doing lots of preventative medicines. Mm-hmm. So giving her medicine so that she doesn't have attacks, that she does well during the day. You don't feel like, oh, I'm going to go to the emergency room, I'm going to go to the doctor. I'd rather give you the right medicine right up front. At the floating hospital, they're in the front line. They're taking care of patients all day long. It's a wonderful opportunity to work with organizations such as the floating hospital so that we can learn how can we take care of diseases better. So at the floating hospital we provide a variety of services. We have a dental clinic. We have a tremendous number of other support services that include health education. So we spend a lot of time talking to children and their families about nutrition, about appropriate exercise, about safe living.
And have a candy.
One of the most exciting aspects of our relationship with Pfizer is their funding the Eagle Circle program. The program really reflects a philosophy of health promotion in a very holistic manner, which the floating hospital has articulated and promoted for decades. So that in many respects it's a natural outgrowth of the programming and philosophy of our organization, and I think serves to link us with Pfizer even more.
One more using the muscles right here. Come on, squeeze them. Good. And rest. All right. Okay, bring them down.
What I'm trying to do here is develop a positive peer culture around health-related activities. Exercise, eating properly, talking about how you're feeling, relating with your peers in a positive way. And for kids with asthma who much of it is physiological, but also some of it is emotional, where their breathing gets restricted and they get tight. And what I try to do is get them to relax, to breathe from the abdominal area. And I'm finding fantastic results with these children.
I came to the Eagle Circle because I heard about it through, the clinic, and It's taught me a lot about keeping a healthy diet and how important exercise is, and I've become a lot more active.
I didn't know how to control my breathing, and I was always on a nebulizer, and I couldn't breathe without it, so that was like my life. But now I know how to control my breathing because Jim taught me, and I feel better now because I can control it.
My daughter's participating in gym more often now. Her grades have gone up a lot more. She doesn't panic anymore, when she has an attack, because now she knows that she can control some of the attacks.
I play volleyball now and basketball, and I play with my friends a lot. I can run around now. I just have to do it at my own pace.
And so this really just fits in right with the philosophy of the company, and that we give back to the community, and the fact that it's a preventative program, it really fits in well.
I think it really is a expression of one of the fundamental beliefs in our business, and that is that we want to work with people. We have a lot to bring, we think, and we think working in partnership with others that we can solve some of these very thorny problems.
And I would hope that there are other corporations out there that would be willing to learn from Pfizer. It really costs them so very little, and it gives us so much.